The Lord is good. I am saying the Lord is good all the time. I want to take this opportunity to invite you to our health nugget today. So the whole of this week, we have been having what we call the Palliative Care Awareness Week. And it's on that account that I'll take the next 5 or 10 minutes to just make some highlights about what palliative care is and how you and your families can benefit from this service. So I am sure that all of us have had experiences where we have had to have a family member who is sick, and at some point it was very difficult navigating through the process of sickness. So in the health sector, palliative care is one of those specialties that bring along humanity. They bring along compassion, comfort, and dignity. Let me take a moment to just let you know what palliative care is, because I think it is important that we understand what exactly it means. So, palliative care is a specialty in the medical care for people living with serious illnesses. And so it focuses on improving relief from the symptoms that are associated with the illnesses, the stresses that are associated with the illness. And while many people think that palliative care is meant for people who are at the end of life, the reality is that it is ideally supposed to begin at the point where a diagnosis for a serious illness has been made. And then it runs all through during the treatment period and even beyond. And the beauty about palliative care is that it does not only focus on the patient, but it also targets families. Because, you know, families, when a family member is unwell, there's a way in which this sickness affects the family dynamics. So it is important that families are also supported during this period where their emotional, their social, and their spiritual needs are taken care of. So the unique thing about palliative care is, number one, it focuses on providing relief from symptoms, from holistic pain, from stresses that are associated with illnesses, and also it comes in handy in handling ethical dilemmas that come alongside the sickness period, you know, by trying to put the patient at the forefront. The second unique thing also is that palliative care takes care of patients who are at all ages, at all stages of illness, and is provided alongside curative treatments. Let me give you an example of a case where, you know, family members do not want, for instance, their child, they don't want the child to know about the diagnosis of the serious illness. Or they do not want, you know, their family members or their father or mother to know about the fact that they have a serious illness. So in palliative care, we try to hold family conferences and support these families in engaging in serious conversations so as to support them. Palliative care also embraces an interdisciplinary approach, and it can be provided by doctors, by nurses, by social workers, by chaplains, by pastors, and other specialties who choose to work together. And the primary goal is to improve or to enhance the quality of life for patients and for their families by addressing their holistic needs. And in this case, in palliative care, the patient is usually given top priority. And we always say this slogan that we add life into their days, and we do that by doing everything possible to improve their quality of life. I'll take a minute to debunk some of the myths about palliative care. So palliative care is not only offered in hospital. It can be offered in many settings, in hospitals, in clinics, in long-term care facilities, and in patients' home. And I've also said that palliative care is not just for the elderly. It takes care of people of all ages, children, adults, adolescents. Anyone who is living with a serious illness is a candidate for palliative care. And does it mean that you are dying? I want to tell you that many patients who receive palliative care, they end up living for many years because this care focuses on improving the quality of their life, and so it has been seen to really help people to live longer. And so one of the golden medications for patients who are suffering from serious illnesses is morphine. And so many people, when you go to hospital and you are prescribed this medication, you imagine that it is going to cause death. But the reality is, church, that morphine, when it is used properly, it is a golden medication in terms of reducing pain. And it is very safe and effective. And the last myth that I want to debunk is palliative care only for cancer patients. The truth is that palliative care takes care of, a wide range of life-limiting illnesses. And some of So yes, church, palliative care is not only for cancer patients. It can work for, it can offer relief and support for a wide, broad spectrum of serious health conditions like HIV/AIDS, patients who suffer organ failure, patients and children who have disabilities that are long-term and other neurological conditions, and of course, a wide range of pediatric conditions. So it is not only limited to cancer patients. Where can you find palliative care support? I am sure at one time or another you've had a relative who is sick, and then at the hospital you are told, please take them home so that they can receive their care from there. This is the most preferred model for African settings, where we take care of the sick in our communities. This service can also be found in hospitals and in clinics, and in hospices and daycare centers. But the bad news is that insurance does not cover this service, and of course there are many advocacy groups that are working tirelessly to ensure that major insurance schemes offer comprehensive care for palliative care services. Africa is very unique in terms of our culture, in terms of our spiritual lens. We look at spirituality from different perspectives, but the beauty about palliative care is that it respects and integrates family structures, it respects traditions, it respects the faith of the patients and all that. So, how relevant this presentation is, especially to us as a church, is because we have a role to play. Palliative care embraces a holistic approach where it focuses on the physical, the spiritual, the psychological, and the social. So in the spiritual model, we see that as a church we can play a very important role in providing emotional and spiritual support to our church members who are going through serious illnesses. And we see this as an act of faith, where as a church we are more compassionate. And some of the ways we can do this is we can mobilize volunteers, we can organize and support transport for patients, we can provide financial relief and act as a trusted source of information. And of course, some of the benefits of palliative care, and I want to highlight a few of them, is that it has superior symptom control, it improves communication, and especially at the level of the family, It enables patients to make decisions. We see that there are improved clinical outcomes, and it also offers support not only to the family, but to the caregivers who take care of patients. So key takeaways from this presentation, church, is that palliative care embraces a holistic approach. It addresses the physical, emotional, social, and spiritual sufferings. It takes care of patients at all ages. It takes care of the family unit, and also it focuses on the community. So in closing, I want to say this, that if you have two scenarios of patients, one, a patient who presents with a broken bone, and a second patient who has a broken heart, and all of them present in the hospital, who will be regarded as a serious patient? One who has a broken bone. But in palliative care, we say the two of them are patients, and we advocate that they receive care, they receive equal attention and equal care, and so you and me can play a role in bringing comfort and dignity to those in our midst who are living with serious illnesses. May God bless you.